Good morning, good afternoon. My name is Clément Jailin, and this talk for MICAD 2021 is about a data augmentation technique for breast mass segmentation. So, what is data augmentation? Data augmentation is a way to increase the dataset by adding some slight modification of the existing data or by creating synthetic data from the existing dataset. A standard way to perform data augmentation is classical data augmentation, often composed of geometrical transforms, for example, rigid body motion, elastic deformation, flips, shear, etc. And or intensity modifications, global brightness and contrast changes. You can change the colors, you can add some noise, etc. All those transformation fields aims to create some equivariance or invariance in the model. However, it may add some limited variability in the training dataset, and it could even introduce some bias. You can easily think of a 6-9 classification biased by a flip. So here in our application, we would like to have a perfectly realistic transformation field. How to have a perfectly realistic data augmentation? Well, if a patient were to take multiple exams in the same day, the intensity variations that we would see on the different images would be composed of geometrical transforms, change in the breast position, and intensity variation, because the acquisition system may be different, because the acquisition parameters may be different. However, all those acquired data should not affect the final diagnostic. So we want our model to be invariant to all those transforms. But we do not have access to a dataset composed of a patient taking multiple exams. We have access to the full history of patients in time. Here is an example. You have one breast with 5 different acquisitions. And between the different acquisitions, you can see some intensity variations and geometrical transforms. So we will study all the history of patients we have in our screening dataset and design a realistic transformation model. This is the first part of this talk, how to design a breast transformation model. The first part is to extract all the transformation fields. This is performed through a registration procedure that is able to extract both the geometrical transforms and the intensity transforms. So on the left part of the slide, you have the measured kinematics and the measured intensity fields for 3 different breasts. So we performed this registration on our entire dataset composed of 583 patients with priors each time. So we extracted 583 fields for the MLO configuration and 583 fields for the CC configuration, MLO and CC being 2 different views in mammography. They are treated independently. So it's a lot of fields. So we decided to reduce it in a principal component analysis reduction technique in order to have a reduced transformation model. This reduced transformation model is composed of space components, patient components, and eigenvalues. We will first start with the space components. Here on this slide, you have 4 components of the displacement field in the CC exams. There is component 1, 2, 3, and 4. So they are quite complex to read. However, component 2 is a zoom-like mode, because the vertical displacement is the vertical gradient, the horizontal displacement is an horizontal gradient. And component 4 is more a rotation-like mode. So this is interesting because in standard data augmentation, you would have used zoom and rotation. Here, we found that indeed zoom and rotation are relevant. Second, in standard data augmentation, you would have to select an amplitude for the zoom and the rotation. Here, you don't have to select anything. Everything is obtained from the reduced transformation model. And finally, this is not a perfect zoom and perfect rotation. This is a more complex field that is perfectly adapted to our dataset. Okay, so all those fields are the spatial components. About the eigenvalues, we can see the eigenvalues depending on the number of components. In fact, this is the error depending on the number of components. And we selected 6 in order to have a highly reduced transformation model. We talked about the space, we talked about the eigenvalues. What about the beta, the amplitudes? The amplitudes can be modeled by a normal distribution. And on the right part of the slide here, you have all the distribution of the 4 first beta values. And indeed, it follows a normal distribution. So because principal component analysis provides from linear coupling, we could have non-linear couplings that would have required some manifold learning techniques. However, here, with the 583 dots that you can see on each plot, we do not see any non-linear correlations. So finally, the generated fields can be obtained from those 2 equations, x being the normal law, gamma being the space fields shown above, and lambda being the eigenvalue. So we can generate some augmented data from one patient acquisition. So here it's a fixed one patient image, and we can generate new data. Here you can see the pectoral muscle is being larger, sometimes it's smaller, sometimes you can see the inframammary fold, sometimes not, as in real applications. Okay, so we have our augmented data sets. Now we can test it with segmentation. Here the goal is not to segmentate mammography images, but CESM images. CESM stands for Contrast Enhanced Spectral Mammography. This is another technique with contrast agents for the imaging of breasts. But now the dataset is very small, composed of 204 cases. We would like to perform data augmentation on these very small datasets. And what we did, we used the transformation model that we learned from the mammography dataset with priors. So this is a variability transferred to the new small dataset. So everything we learned in the previous slide will be used as data augmentation for another dataset composed of contrast-enhanced spectral mammography data. And finally, we use UNet-like architecture to segmentate the lesion. Here are the results. We have 3 different cases. The first one is performed without any data augmentation. This is the red curve. The second one in between is the classical data augmentation performed with rotation, translation, shear, and histogram equalization. And finally, the realistic field. The realistic is better than the 2 other approaches. This is the diagram on the left. Diagram on the right, here you have the efficiency with the dice coefficient with respect to the number of components. Remember that we selected 6 components in order to have a very reduced model. However, if we wanted to select more components, we would have a better dice. So here we see that a larger model may be better to perform the data augmentation. So there is an improvement with both metrics, dice, IOU on the proposed approach. As an example, 32 images with augmentation is equivalent to 100 images without data augmentation. So there is a huge gain to use data augmentation method. Finally, the entire method is completely automatic. We do not have any hyperparameter to be tuned. Everything is learned from the reference dataset. Almost the last slide. Here is the realistic data augmentation method compared with the standard data augmentation approach. The 2 segmentation results are compared with ground truth. You can see that there is often an improvement, even if some cases are still very complex. So to conclude, data augmentation based on realistic transformation improve the efficiency of the segmentation network, especially when the dataset is very small. The augmentation model can be obtained even with very, very small datasets. And this is not the case for augmentation techniques based on generative model, for example. The realistic transformation model does not require any hyperparameter, and it provides augmentation without any bias because it's realistic. And finally, this augmentation technique could be coupled with other augmentation techniques such as GAN or autoencoder. Thank you for your attention, and I would be glad to answer all your questions. Thanks.